Kids are usually the first ones to get it. So early on, the schools will start having a little bit of absenteeism. The teachers will know it, but the kids sort of sail through it pretty well. They're most vulnerable since they've never seen many years of flu before, and therefore they don't have antibodies. At the end of the spectrum, their grandparents and stuff have seen a lot of flu, but if they get it, they have worse outcomes. And almost always it's inhaled. A person has it in the respiratory tract, they start coughing and sneezing, little tiny droplets that go 3, maximum 6 feet depending on the strength of your cough. Then you breathe it in, the little particle lands on your respiratory tract and starts multiplying. It'll multiply up here and make you have all sorts of fevers and things. Then it can go to your lungs depending on severity. There's more social contacts, particularly probably with elderly people who maybe their routine is maybe a quiet routine where they go out and do a few things, shopping and things, but suddenly all their grandkids and everybody comes in. So their potential to be exposed to a kid who, as I said before, more likely will have the flu early than anybody else, and then sort of hug, kiss, shake hands type stuff. So just the number of interactions goes up a lot at that point in time. Plus the seasonality of the flu is the highest weeks usually are somewhere December, January, February. So those two interactions of higher social contact, particularly with older people who may be ill and generally homebound most of the time otherwise, is a higher risk for hospitalization and things. In a healthy person, it's self-limited. You'll get it, you'll be sick, fever, headache, 3 or 4 days. You should hydrate yourself. You should take some Tylenol or so if you need, for aches and pains and stuff. But on average, a healthy person shouldn't need anything. They should practice cough etiquette, obviously. If you're coughing and sneezing, cover, that sort of thing. People who have diseases, diabetes, asthma, heart, lung disease, if they start getting the flu, they are better off to see the doctor within 48 hours and get started on an antiviral such as Tamiflu. That both shortens the course a little bit and decreases the chance they'll end up in the hospital very ill. I think for most people, going to the doctor is not necessary. If you have underlying conditions, I think the answer is you should be checked. But otherwise, if you're a healthy person, you should anticipate you're going to be poorly functional for 3 or 4 days. So you've got to stay away from work for the days you have fever and stay away when you can't control coughing well. When you consider CDC, I think said in the last year or so, 80,000 people died of flu, 200 kids died of it. Anything that puts a dent in that is a good thing. You may feel like you're as strong as can be and have no illnesses, but if you get the flu and really don't suffer yourself and transmit it to your loved one you care for, that's something you could have prevented.